Alright, so today we are going to start with the muscles of the head, face, neck. When we're talking about the muscles of the head, the ones that are going to be important are going to be the frontalis muscle, your orbicularis oculi, the nasalis, your zygomatic muscles, major, minor, the orbicularis oris, and then the platysma. On the other side, sternocleidomastoid, your mentalis, your masseter and your buccinator, and then your temporalis up here. Looking at it from a different angle, again, orbicularis oculi, frontalis, nasalis, your zygomatics, orbicularis oris, mentalis, platysma, sternocleidomastoid, buccinator, masseter, and then your temporalis. The first muscle we're going to talk about is your frontalis, or sometimes called your occipitofrontalis, because you have this frontal belly right here, and then your galla aponeurotica, which is just a big tendinous sheath that then hooks up with the occipital belly or the occipital muscle, just depending on how you want to talk about that. The insertion of your frontalis muscle is right here on your orbicularis oculi, and so the origin is up here, insertion is down here. When you contract that muscle, it is going to pull up, and so when you contract your frontalis, it raises your eyebrows. So if you want to raise your eyebrows, you have to contract your frontalis muscle. The next one is the orbicularis oculi. So this is the muscle that the frontalis inserts on. And what the orbicularis oculi does, it's a circular muscle, and it allows you to close your eye. Levator palpebrae superioris is antagonistic to that. So, antagonistic means it does the opposite. So if orbicularis oculi allows you to close your eyelid, levator palpebrae superioris allows you to open your eyelids. And it's in the name. So levator is talking about pulling stuff up. Palpebrae is the fancy word for your eyelids. And superioris tells you it is above. And so it is a muscle that is above that pulls up your eyelids. And so it allows you to open your eyes. Then we have the nasalis. So origin is down here on the maxilla. Inserts up here on the nasal bone. So when you flex your nasalis, you flare out your nostrils. For a lot of these things, as we're talking about them, again, it will help cement it in your brain, in your mind, if you do those contractions and also palpate it or feel where those muscles are and what they're doing. So go ahead and flare out your nasal or your nostrils to feel your nasalis contract. You can feel how it stretches across right here to open up that nostril. Go ahead and raise your eyebrows so you can feel that frontal muscle lifting up your eyebrows. Close your eyes so you can feel the orbicularis oris closing your eyes. The next one is going to be your zygomatic muscles. So you have your zygomaticus major and minor. This is the smile muscle. So when you smile, you have origins on the zygomatic bone, and it inserts down here onto the corner of the mouth on that orbicularis oris. And so when you contract that muscle, it pulls this up, right? So when you smile, the corners of your mouth go up. It is your zygomatic muscles that are also responsible for dimples. So if your zygomatic muscle is bifurcated right here, that can give you dimples when you smile. And there's a surgery where people can go in and they can cut that zygomatic muscle and give you dimples if you want dimples. The next muscle is the orbicularis oris. This one's really easy to flip-flop with orbicularis oculi. But just think, oculi is talking about your eyes, Orbicularis is saying it's round, so orbicularis oris is a round muscle talking about oral, your mouth. This is the kissing muscle. So kind of how oculi allows you to close your eyes, orbicularis oris allows you to close your mouth. And what it does is it allows you to pucker your lips. So when you're going to kiss somebody and you push your lips out, that is orbicularis oris. It is the duck face muscle, allowing you to push your lips out. The next muscle is the platysma. So the platysma is a very superficial muscle and covers a lot of the other neck muscles, and it comes from down here on the clavicle deltoid region and inserts up here on the lower lip. This muscle allows you to pout. It pulls down the corners of the lip, and you can flex it really hard by pulling down those corners of the lip, and you can even see it pop out. So this guy, you can see his platysma on either side stretching tight. The next muscle is the sternocleidomastoid. Big word, telling you exactly where it is, right? So sternocleido is referring to that origin on the sternum and the clavicle. Mastoid is talking about the insertion point on the mastoid process of the temporal bone. So if it inserts up here, when it contracts, it's going to pull down. So this is important for head rotation. It's also important for bringing your ear down to your shoulder. You're using your sternocleidomastoid. It's that really big muscle on the side of your neck that runs up. The next muscle is the mentalis. Mentalis helps you with the pout, and it brings the soft tissue of the chin up. So whenever you pout, you kind of pull this part up so you can pucker out that lip. Your mentalis, and here you can see those mental foramen, right? This is the mental region. The next one is the masseter. The masseter is important in mastication. Mastication is chewing. It has the origin on the zygomatic bone, inserts down here on the mandible. So when you contract this muscle, it is going to pull up. And so your masseter is important in closing your mouth, right? Adds to your bite force. And you can feel it if you push on your cheeks right below your zygomatic bone, and then you bite down, you can feel that muscle contract. Then we have the buccinator. This muscle is really important to keep food between your teeth. Whenever you're chewing, sometimes you might accidentally bite your cheek. Why are you biting your cheek? Because the buccinator is trying to keep food in between your teeth, and sometimes you bite down too soon and accidentally bite that muscle or bite your cheek. It's also important in whistling or blowing anything up. If you have to blow up balloons for like a party or something, you force out that air and you can get that air in your mouth and then squeeze your cheeks. You're squeezing those buccinators to force out that air. A buccinator is another word for a trumpeter. And so people who play musical instruments, especially stuff like the trumpet, where you really need a lot of cheek force, you're using your buccinators in that. Then we have our temporalis, another important chewing muscle, a muscle used for mastication. This one has the origins up here on the temporal bone, and it inserts down here on the mandible. And so it allows you to, again, close your mouth, so when it contracts, it pulls up. And you can feel this muscle if you reach up where your temporal bone is, and then you bite down, you can feel that muscle contract. And that's all the important ones I want you to know for the head. As we move down to the neck, we have our digastric muscles, anterior and posterior belly. thyrohyoid, omohyoid, sternohyoid, sternothyroid, trapezius, and then your pectoralis major. These we'll talk about later when we move down. But they're important, and you can see them in this figure. So your digastric muscle, refers to two, gastric refers to belly. And so when you look at your digastrics, you're going to have two bellies to this muscle. The origins are going to be on the mandible, so right here, and on the mastoid, and they all insert right here. So when you contract this muscle, what's going to happen? Well, this hyoid bone is going to go up because these two are pulling it up. And so your digastrics help to elevate your hyoid bone, which is important in swallowing. The next one is your thyrohyoid. This one depresses the hyoid. So if you look right here in this darker red, you have it inserting on the hyoid, and the origin down here on the larynx. And when you contract it, it is going to pull the hyoid down, and it's going to slightly elevate that larynx. Again, very important in swallowing, so you don't choke on your food. You lift that larynx, and the epiglottis gets pushed down by the tongue, and so food doesn't go down your windpipe. Your omohyoid also depresses the hyoid. It has origins back here on the scapula, so you can see it going back behind the collarbone and coming up on the scapular spine before the cricoid, before the acromion. So omo means shoulder, so it has origins on the shoulder and inserts on the hyoid, so when you contract it, it's going to pull it down. It's going to depress that hyoid. Then we get to sternohyoid. Origins on the sternum, inserting on the hyoid. So when you contract this muscle, it's going to pull down the hyoid towards the sternum. Lots of these muscles depressing the hyoid. A lot of these muscles are used in swallowing and talking. Then we have the sternothyroid, not to be confused with the sternohyoid. The sternothyroid goes to the thyroid cartilage on the larynx. And so this one comes up, not to the hyoid bone, but to the thyroid region on the larynx. It's important for depressing the larynx, and so it's on the sternum, and it pulls down that larynx. And that is it for head, face, neck muscles. We will pick up with chest muscles and back muscles next time.